This is Libby, and I'm going to be looking at the NHS. War highlighted the inequality in the post-war world, leading to many later reforms. When children were evacuated to the countryside, more people realised the difference in living standards between people in different areas. Some evacuated children were in a very unhealthy state. The need to raise large armies made the government aware of the problems created for society by an unhealthy workforce. The government realised the importance of having a healthy population. David Lloyd George wanted to have homes fit for heroes. After the First World War, overcrowded housing was banned. In 1918, it became compulsory for local councils to provide health visits and support for pregnant women. In 1919, councils started to build housing for poor families. In 1919, a Ministry of Health was set up. This looked after sanitation, healthcare, and the training of doctors and nurses. Then the later reforms were in 1934, the Free School Milk Act that meant children could have free milk in schools. This was critical as Britain was hit by the Great Depression. Evacuated children in the Second World War triggered outrage as people saw how unhealthy they were. Almost 1 million homes were built by the Labour government between 1945 and 1952. The New Towns Act of 1946 created whole new towns like Milton Keynes and Telford, close to large cities. So what was the role of the Ministry of Health? We know it was to look after sanitation, to control healthcare, and also to oversee the training of doctors and nurses. So new towns were built in the UK after World War II. The New Towns Act was passed in 1946. We know, let's just recap, that 1 million homes were built by Labour after World War I, and new towns such as Milton Keynes and Telford were built close to large cities. The Beverage Report and the Welfare State. In 1942, Sir William Beveridge, a Liberal politician, wrote a report about the state called the Beverage Report. It was very popular and sold over 100,000 copies within a month. The report claimed that everyone had a right to be free of the 5 giants: disease, want, ignorance, idleness, and squalor. It highlighted that people's quality of life needed to improve and suggested that the government should be responsible for this. The report suggested that welfare should be available to everyone in need. It should be paid for by taxpayers, non-means tested, which means it's available to everyone, and compulsory for everyone. The government's involvement in improving public health and social security is called the welfare state. The welfare state was implemented by the Labour Party, led by Clement Attlee, in 1945. The welfare state included a health service that was free at the point of delivery, a weekly allowance for families to look after their children, and a benefit system to give financial help to the very poor. In 1946, the New Towns Act was set up to plan new towns, as I mentioned earlier, such as Milton Keynes. In 1956, the Clean Air Act established smokeless zones in cities. And in 1980, the Black Report said that there were still inequalities in health between the rich and the poor. So the Beverage Report claimed that everyone should be free from the 5 giants. And to recap, these were disease, want, ignorance, idleness, and squalor. So this led to the creation of the National Health Service, or the NHS. The NHS was set up by Aneurin Bevan in 1948. People had received free healthcare during the war from the Emergency Medical Service, and people wanted the service to continue. So for the opposition to the NHS, there was not unanimous support, which means that it was not 100% supported. Doctors did not want to be employed by the government. Also, this public good meant that doctors could lose some of their income. Bevan promised to pay doctors a salary and allow them to continue working privately as well. Lots of Conservatives also disliked the NHS, but it was too popular to abolish or get rid of. So what is the cost of the NHS? The cost of the NHS has increased dramatically in the last 70 years. The original plan was to pay for the NHS through national insurance contributions, but this only covered 10% of costs. In 1948, the NHS budget was estimated to be £15 billion. In 2015/2016, the NHS budget was estimated to be £116.4 billion. So what is the success of the NHS? The NHS is considered to have been relatively successful. Child mortality rates have fallen, and maternity services are likely to have helped this. New and improved hospitals have better facilities. Vaccinations which are provided under the NHS have completely removed some diseases like tuberculosis. And healthcare and affordability of treatment is a lot better in Britain relative to the United States. Today, drugs are very expensive, and medicine lets people live longer, but older people on average need the NHS more. This increases the cost of the NHS. The question today is who should pay for which treatments, and how can enough money be raised to pay for all the treatments needed? To deal with these questions, the National Institute for Health and Care Excellence, or NICE, and a metric called Quality Adjusted Life Year, QALY, valuing a life at £30,000 per year. This metric helps to compare where money should be spent. There's also an emphasis on more preventative healthcare. Preventative healthcare is often cheaper than medical treatments. Campaigns encouraging healthy eating and discouraging smoking and drinking have been introduced. The Healthy Eating campaign promotes eating 5 portions of fruit and vegetables every day. In 2005, tobacco advertising became legally banned. Things like cancer screening are preventative measures that try to find people vulnerable to cancer or in the early stages so that treatment is more cost-effective and people get less ill. So what have we just learned about the NHS? So first of all, we know that lots of Conservatives disliked the NHS. Also that Bevan promised to pay doctors a salary and allowed them to continue working privately. And finally, that the original plan was to pay for the NHS through national insurance contributions. So why was there progress in 20th century medicine? The 20th century brought improvements in living conditions, transplants, blood transfusions, penicillin, plastic surgery, radiotherapy, and many more vaccinations. Medical progress was far higher than any century before it, and this was due to a lot of factors. First of all, communication and knowledge. Revolutionary ideas can diffuse slowly. Fleming's discovery was not recognised for many years. However, the printing press allowed his publications to be read more widely, and they reached Florey and Chain. Inoculation was first brought to the UK by Lady Montagu, who observed it in Turkey. Discoveries from France, Pasteur, and Koch in Germany spread faster because of improvements in communication. The government is another reason. The US government funded the initial mass production of penicillin. The improvements in living standards in the UK only really came from government action. And mandatory reforms in the form of the 1875 Second Public Health Act and the welfare state seem to have had the largest impact on living conditions. War is another reason. Chain and Florey received funding to mass-produce penicillin, partly because of World War II. The World Wars meant that a lot of people needed plastic surgery and prosthetic limbs. Blood transfusions were also needed on the battlefield, and the Boer War made Parliament realise that a malnourished population was not in their best interest. The fourth reason is remarkable individuals and the scientific approach. Individuals like Louis Pasteur, Robert Koch, Alexander Fleming, Sir William Beveridge, and Seaborne Rowntree all had impacts on society larger than you would expect from one individual. Science involves the objective observation of outcomes, but it also requires building upon the knowledge of previous scientists. Blood transfusions, for example, needed an understanding of blood groups, which relied on the discoveries of William Harvey around circulation. And finally, chance. Fleming discovered penicillin because he left bacteria out in his laboratory. Lots of people only discovered the unhealthy state of British children because of evacuation in the war. And the Liberal Party was influenced by the launch of the Labour Party in 1900 as it pushed through its reforms at the start of the 20th century. So, as I mentioned, this last reason was chance. Fleming was so lucky because he accidentally left the bacteria out. Perhaps if he'd not done this, he wouldn't have discovered it. Medical progress was far higher than any century because of the many factors I've just mentioned. So first of all, communication and knowledge, then government, war, remarkable individuals, chance, and finally, a scientific approach. So let's just think back on the Parliament and why war was a really important factor which influenced the government's changes. So first of all, the need to raise large armies made the government aware of the unhealthy workforce. Secondly, some evacuated children were in a very unhealthy state. And finally, when children were evacuated to the countryside, more people realised the difference in living standards. So we learned about the Beverage Report earlier, which happened in 1942 and was written by Sir William Beveridge, which was very popular and sold over 100,000 copies. So let's consider some individuals who had a large impact in medicine. First, we had Louis Pasteur, Robert Koch, Alexander Fleming, Sir William Beveridge, and Sibo Rowntree. And the social reforms which took place, which led to these changes in the 20th century. We had the New Towns Act in 1946. In 1980, there was the Black Report, which highlighted the inequalities in health between the rich and the poor. And in 1956, the Clean Air Act, which established smokeless zones in the city. So I discussed earlier about the success of the NHS. So we know now that vaccinations were able to remove TB. We know that child mortality rates have fallen. We know there are new hospitals and better facilities, and that healthcare is more affordable, especially for poor people. So just to recap on the Beverage Report, this suggested that welfare should be available to everyone in need. It should be paid for by taxpayers, it should be non-means tested and compulsory for everyone. So in 1948, the NHS budget was estimated to be 15 billion, whereas in 2015 and 2016, it was estimated to be 116.4 billion. So, just to recap on those social reforms again, we know that in 1946 there was the New Towns Act, we know in 1980 there was the Black Report, and in 1956 there was the Clean Air Act. Right, that was a very long episode, but that's everything for this topic. There's now one more episode in the topic for modern Britain and medicine, and this is a case study. So I hope you enjoyed this episode, and thanks very much for listening.